Hi, I'm Maddie. We're going to demonstrate a urinary catheter today. First, you would check the patient's order and make sure the doctor has ordered a urinary catheter. You would bring 2 urinary catheters in, but since this, for demonstration purposes, it's been disheveled, so it's a little like that, and we brought 1 in. You would open the curtain and close it for privacy purposes, and then you use the hand sanitizer on the wall and use hand sanitizer before coming in. You would introduce yourself to the patient. Hi, my name's Maddie. I'm going to be your nurse today. Then we would ask for their name and their birthday, and you would verify that on their wristband. And then you would ask for the patient's allergies. You would ask them if they had allergies to betadine, iodine, latex, or any type of lubricant, because this would change the Foley catheter that you would use kit because they were allergic to it. Then you would tell the patient that they are getting a urinary catheter today, and you would describe the procedure. So today we're going to give you a urinary catheter, and what we're going to do is put a tube up your urethra, and it is going to expel your urine out of your bladder for you, since you've been having issues expelling the correct amount of fluid that the doctor has noticed. And then you would ask them if they had any questions or concerns, and you would answer those questions or concerns. So then we would start our procedure, and we would let the covers all the way down. And we would pull their gown up. We would place a towel over their abdomen for privacy, and we would place them in the dorsal recumbent position with their legs out. For men, they could just be lying supine. Then we would clean the perineal area. So we would wash around the perineal area, we'd wash up and down the shaft, and then we would use the corners of the washcloth to go around once, twice, 3 times. And then we would dry off the entire perineal area. We'd make sure it's dry before doing anything. Then we would take off our gloves and reapply hand sanitizer, and then we could start our procedure. So we would take it would be in a package, but it's a little disheveled. We'd place it here, and we'd use sterile field so we go away from it, and we'd only touch the outsides of it. So this would be all in our sterile field. And then we would take this, and we want it on the shiny side to be on the bottom. So we would place this under the patient. And since this would be only part of it, would be part of our sterile field. Then we would take our sterile gloves, and for demonstration purposes, they are blue gloves because the other sterile gloves broke, but we'd still use the same sterile field as before, using our 1-inch barrier. For your first one, you would grab the inside, because that is sterile, and we would place above our waist. And then we would use these fingers and grab inside the cuff, because that's sterile, and since your hand is sterile, you place above. We try not to, make sure this is all above. And now we can reposition it, since it is our hands. Okay, now we are ready for the procedure. So we're gonna grab our fenestrated, and we're gonna make sure, we're gonna let it all out. And we're going to fold back. So we are being sterile, and we're gonna try not to drag, and we're gonna go up and make the hole opening for the penis. So this is part of our sterile field. So now we're going to move our tray to closer so we have a more of a sterile field. Now we're going to take everything off before we touch the penis so we don't contaminate everything. So we're going to take off this and place it lightly here. It's still in our sterile field, but we're going to place it back. We are going to uncap the balloon, and we're going to place it here. We're going to uncap the lubricant. We're going to take the iodine and put it on the cotton balls. We're going to throw that away. We're going to open up the specimen if we're going to take a specimen right as the urinary catheter is inserted. And we're going to place that there. Now we are ready for our procedure. So we are going to use your non-dominant hand to grab the penis and clean around it before the procedure. So we're going to grab the penis, and we're going to take one cotton ball and circle around once, twice, 3 times. And then we are going to administer the lubricant. We're not going to put all of it, but you want to have a lot in, and you would administer that and then throw it away. And then we are ready for our procedure now. So we would hold it 2 inches. 2 inches, and you'd ask the patient to bear down. So you'd say, tell the patient to bear down, and you would slowly and not forcefully insert the catheter. I think we might need. Here we go. Okay. You would go all the way to the Y, which is this point right here in a male. And once you see fluid flowing, then you would know. So once you are done inserting it, but for demonstration purposes, it's not going to go in all the way, you would let go of the penis and grab onto the tube. You would inflate the bulb all the way, with all of the water, because you want the balloon in place. If the patient has a discomforted face, it might be in the wrong position. And now we would uncap it, and we would clean up everything. We would then tape the tubing to the abdomen for a male, or even to their thigh, and we'd place this on this side of their bed, right here. And you don't want it on a side rail or anything of that matter, because it could be put up, and you want the bag below their waist. So then we would clean everything up, and we would take our gloves off and clean everything up for the patient. And you would document that the patient didn't have resistance, or if they were feeling pain or anything of that matter, and you would document their output in here. For specimen purposes, you would either put a tube in the other with a syringe, and you would ingest it like this. And the only way that you can take a specimen from a bag if it's right from the urinary catheter. Lastly, you would do the same thing with taking out a urinary catheter. You would come in, you ask the patient for their name, their birthday, allergies. You would clean the whole perineal area. You would put a pair of gloves on, and then you would take out the catheter in the way of, you would take it off the leg, you would put the bulb back, you would sterilize the area for 15 to 30 seconds, you put the bulb back in, you take all the water out, make sure that you don't cut it or anything like that, and you would remove the entire tubing, and you would put it all in your a disposable towel, and you would document the output of the urine and of the water in the bulb, and then you would be done with your procedure.